My name is Katie Huffling, and I'm the Executive Director for the Alliance of Nurses for Healthy Environments. So glad to have all of you here. And we are really excited to have this first webinar of the Reinvigorated Practice Forum. And we are thrilled to have Lisa Hartmeyer and Laura Hart as the new co-chairs. So they're on the call here today. And we're hoping to do a series of webinars with the Practice Forum. And when we send out the evaluation and post-test, there'll be a section in there. If you have ideas for future webinars or topics that you'd like us to cover, please let us know, because we really want to make these webinars as useful as possible for all of you. For this webinar, Annie is able to offer 1 hour of free continuing education credits. In order to receive those credits, we'll be sending out a post-test and evaluation, and you'll need to do that in order to get those credits. So just be on the lookout. It'll take us probably a couple days to send that out to you, so just be on the lookout. And with that, I'm going to turn this over to Lisa Hartmeyer.
Good morning, everybody. So glad to see you all here today. I wanted to introduce Dr. Sandra Curtis. She is currently a principal investigator and program director at the Public Health Institute. In her previous role as director of innovative projects for Plastics Pollution Coalition, she began investigating behavior change strategies to reduce the exposure of toxic chemicals used in plastics. She's been expanding that work to include other endocrine disrupting chemicals in populations characterized by fast growth and with marginalized communities. Sandra spent over 20 years as a producer, educator, and writer, creating an extensive body of work across internationally acclaimed media projects. With that, I'd like to introduce Dr. Curtis to give us a talk about rethinking plastics.
Thank you so much for that lovely introduction, Lisa. It's very nice to be able to meet with all of you. And I just wanted to acknowledge the incredible work that you and your colleagues have done during this this ongoing pandemic. I just think it's that we need to make a statement about our appreciation for the work that you've been doing. So with that, I will share my screen. And get started. So, as Lisa said, I had previously been the director of innovative projects for an organization called Plastic Pollution Coalition, which has been around now for about 10 years. And they early on started focusing on the plastic pollution issue, primarily from the environmental perspective. And when I started working with them, the issues of environmental toxins and the chemicals that were in plastics, the bisphenols and the phthalates, were a subtext for what most people knew of as the Great Pacific Garbage Patch that was starting to get on people's radar. And I had basically said at the time, look, I think within 5 years, if we don't have it on the national agenda, we're in big trouble. And we're in big trouble already. But the fact that at this point now, there's federal legislation that's been introduced in the last year's Congress and once again this year, just a few weeks ago, we're making huge progress, but we also need to make movement in a number of different areas, which is happening. So what I'd like to do is talk to you about the little tiny piece of work within this area that I had been doing and am looking at continuing doing, give you a broader perspective of why this is so important within the general context of climate change and the environmental issues that we are confronting, and then look at some of the ways in which the research that I did, what we're doing as ongoing and looking to do, to entertain any questions you might have, and also kind of cover the aspects of change that are gaining traction within the community. So,
Sandra, this is Katie. I'm sorry to interrupt. Are you able to switch to the regular full view? It's harder to see on the screen in the presenter view.
oh, I'm so sorry. I thank you for saying that. Most of the time, this is what people have asked me to do. So
There,
I'm happy
that's
to do that.
perfect.
Thank you for raising that. My apologies.
No worries. And also, I forgot to mention, folks, and Lisa had also put this in the chat. If you have any questions for Sandra, feel free to pop them in the chat as we're moving along.
Okay. Thanks again. And my apologies. Anyway, all you missed was the cover, the opening screen. So when we look at plastic pollution and climate change, they're really two sides of the same coin, because fundamentally the focus for both and the origins for both is the petrochemical industry, fossil fuels. So some of you may recognize, some of you may be in my age range and actually remember when you got your first plastic bag. I certainly do. I had gone on a family trip to Las Vegas, and they gave us plastic bags with the Riviera Hotel logo on it to use for our bathing suits. I kept that for years because it was the only one I'd ever had. And think now about the ubiquity of plastic bags and other plastic products in our lifestyle. Some of you also may remember the movie The Graduate with Dustin Hoffman, and there's a moment in there which mostly everybody, when I was actually doing full-time work in plastic pollution, would say to me, "Oh, the graduate, plastics." And there's a graduation party for this young man, Benjamin. He's escorted out by one of the family friends, and he says, I want to say one word to you, just one word. And Benjamin looks at him and he's very confused. And he says, "Yes, sir. Are you listening?" "Yes, sir. There's plastics. There's a great future in plastics." Well, we have subsequently created such a great future in plastics that we've created an urgent global crisis. And this dramatic uplift of the amount of plastic that's being produced is evidence of what that global crisis is. Throughout its lifetime, it's a source of serious greenhouse gas emissions, and that, as you well know, contributes to climate change. The problem with the plastics, not only are they being produced, but there's no way. If we look at the Ellen MacArthur Foundation did a report that came out at the beginning of 2018, and it was promoting a circular economy. And that's when you take materials at the beginning and the development of a product, and it goes back to its natural state at the end. And the projections from this report were pretty dire. And one of the quotes that you will often hear that's become a prominent quote is that by 2050, if we continue using plastics the way we have, there will be more plastic in the ocean by weight than fish. National Geographic the following year did a beautiful illustrative issue, and they have taken on this issue of plastic or planet as an environmental issue. And these are some of the images that were promoted from that magazine report. This was another chart that was produced within that. And if you look at by sector, the number of tons of plastic that were produced and the short time frame within which they're being used. So 450 million total tons, consumer products 46 million, discarded within 3 years, packaging mostly all discarded within 6 months, and that makes up almost half of all the plastic that's been made. And some of the plastic, single-use plastic, as you'll recognize, like straws and coffee cups and utensils, plastic utensils and clamshells, probably are thrown away within an hour of their use. Most of the plastic comes from land into the ocean. And this shows the total plastic weight, global production, and what ends up in the ocean. This is an old chart. The numbers are much higher now. There's a researcher named Jenna Jambak who has been doing most of this work to look at the amounts that are going into the oceans. And she had a visual in a talk that she did that really struck me. She said, if you took a person who's about 5 feet tall and had them hold a garbage bag, and you put one person along every single line of coastline around the entire world, that trash in that bag would be what the volume of trash going into plastic trash going into the ocean is on a yearly basis. So most of the time when people look at the life cycle of plastic, they're looking at when you get it in your hand and when you throw it away. The issue is that the life cycle of plastic extends much, much longer. It is from the initial fuel extraction, because as I said, most of the plastic, 99% of plastic comes from fossil fuel extraction. So there's what happens at extraction and transport, then production and manufacturing, then the disposal and waste, and the environmental impact that follows. And this work was done, and it was very seminal work. These 2 reports were published at the beginning of 2019 by a group called the Center for International Environmental Law. And they did two reports. One was plastic and climate, and one was plastic and health. And we're looking at the hidden costs of what this means to the planet, both in health and in climate impacts. One of the things that we know is that the petrochemical industry is looking at massive expansion, and that has been on track for the last number of years. There has been more movement to obstruct and stop these what are called cracker plants, and they are a result of the fracking industry and the growth of the fracking industry. And this woman, her name is Linda Baumgartner. She is in Pennsylvania in the what's called Cancer Alley there. There are a number of cancer alleys that are around the United States, particularly in that Ohio River Valley and in the Baton Rouge, Louisiana area. And this is a retired teacher who was leading a movement locally against the opening of yet another cracker plant. And she was talking about not only the environmental impacts, but the human health impacts. And one of the problems that happens is in these depressed areas, people are looking at jobs at the manufacturing of the plant, but then what happens once the plants are in operation and the number of jobs drops dramatically, yet the health effects from them are very significant. Refining plastics, one of the most greenhouse gas producing intensive industries, and growing fast. But when you think about the breakdown of the plastics, some astonishing research was done by a woman at the University of Hawaii, that even these tiny little plastic microplastics emit greenhouse gases, and it's promoted by the interaction with the sun on them. And so as they exist, they continue to produce greenhouse gases, even though they may be in small amounts. This report just came out last June, and I hope you can see it. I have resources to share all of these with you afterwards. I'll make sure that I share them with Katie and Lisa and Laura. But we need to really understand the links. And this I liked as a demonstration, a graphic demonstration of where the impacts came from. So you see at the root, oil, gas, and coal are at the root of all of these, and consumer products are down there on the bottom right with plastics. And we look at both the loss of biodiversity and climate change. They're all interconnected with the production of fossil fuels. When we think about this massive expansion that British Petroleum is looking at over 20 years, from last year to over the next, look at the volume in plastics of what they're projecting. 1 ton of plastic equals 5 tons of carbon dioxide, and that's roughly twice the CO2 produced by a ton of oil. There are also significant externality costs from the production of plastics that we don't think about and see, but that are getting paid, and basically they're getting paid by poor people, because these plants are located in lower income communities. It becomes a huge environmental justice issue. Toxic incinerators, plastic waste, and areas of high air, water, and soil pollution. This one is one of my pet peeves, because we have been locally, we've been sold a bill of goods about recycling as the answer. Oh, if we just recycle more, this will be, we'll be able to take care of this problem. And that is absolutely not the case. In 2015, the EPA estimated that overall recycling in the United States, total overall recycling of plastics was 9%. That's projected and has been demonstrated to be going down every year since. So when I was at Plastic Pollution Coalition, we had an independent researcher, mechanical engineer, who had been working in this area, do projections for 2019 and then 2020. And she did them based on the EPA numbers, and then collected a lot of other information, and projected that in 2019, the overall rate would be 4%, and that by 2020, it would be down to 2.5%. Some of that is because some of you may have heard about China's national sword. In January 2018, China refused to take any more of our or the world's recycled plastic for recycling, and that shut the doors on a major part of where recycling went. I know specifically in the city of Berkeley, where we had the first curbside recycling operation in the country, one of the things that was happening was that they had vetted the vendors that they were sending our plastic to in China, but at some point that just stopped. So currently we are collecting plastic curbside, but it's going down to a place in Los Angeles, and a lot of it's getting landfilled because there's just nothing to do with anymore. And the cost of the recycling is increasing, and it's being and there's an inherent problem with it because virgin plastic is so cheap. So despite what Coca-Cola and Unilever and some of the other biggest offenders have been promising, the numbers aren't looking good. This is probably some of the things you may have seen around your neighborhoods, but when you think about single-use applications, so when I mentioned straws and silverware and cup lids, at Plastic Pollution Coalition, one of our project managers was a woman named Jackie Nunez, who had started an organization called the Last Plastic Straw. And people would say to her, why are you worried about straws? And she'd say, because they are the keynote way that people get into understanding the plastic pollution problem. If you can understand the massive amounts of plastic straws that are used every day and thrown away, and there is no way to recycle plastic straws, nobody wants them, nobody can use them, so they are immediate trash, then you begin to understand what the magnitude of the problem is. So in addition to there not being good ways to recycle it, there's ocean leakage, there's open burning, and then there's the leakages that happens on land. The other is that there's no real guidelines for plastic products, and so there's all kinds of resins that are used in them, and it's difficult to essentially clean them up to have them be used a second or third time. And even when when plastic can be recycled, we used to call it downcycling, because there's a limit to the amount of times that you could actually reuse plastic. Sadly, one of the ways that plastic is being dealt with fundamentally is incineration. At least half of Philly's recycling goes straight into an incinerator. And then when you think about what the result in the air is, and then the toxic ash that gets put into the air, we breathe it, and then falls down onto the soil and gets absorbed in the soil. Again, the environmental issues become immense. This is along the shores of the Great Lakes. This is what happens. 10,000 tons entering the lakes every year. Global impacts: plastic fibers, plastic microplastics, microbeads have been found at the highest places on Earth and in the lowest places. The Mariana Trench is 36,000 feet deep. We also know that there are other ways that we get plastic into waterways, and some of it comes from personal care products, the microbeads that in 2005, a federal bill banned microbeads in personal care products that Obama signed. But there's also tire breakdown. Microplastics break down in tires along the roadways. So when you think about tires, and then you may have read or heard about innovative uses of recycled plastic in roads. Think about the tires breaking down and then the roads breaking down, all that is going to wash into the waterways. We've got microfibers coming out of dryers from clothes. When you think about fleece, that is fleece are plastic fibers that have been woven. They're lovely and soft and comfortable, but they're ending up. This photo here shows the bright red is the output of a dryer, and the fading orange dots are evidence of fibers that have come out of the dryer vent and are all over this yard. And then there's the problem of nurdle spills. So once plastic, if plastic is recycled, it is essentially melted down, cleaned, and then turned into what are called nurdles. And there are these little small plastic pellets. Next time you're at a beach anywhere or along a shoreline, see if you see any of these little pellets. They're everywhere. And the word nurdle is an interesting one to me, because it was an everyday use in the work that I was doing with Plastic Pollution Coalition. And I was listening to, some of you may be fans of, on the weekends, Says You, and they play these word games on NPR. and oftentimes one of the games is that they will take a word that you're not sure if it's a made up word or a real word, and people will make definitions of it, and then the opposing team will guess what the real definition is. So nurdles came up a couple weeks ago as a word that was either real or made up. And it was fascinating to me that while it was so much in my lexicon, it's not in the public lexicon. So I actually proposed to Plastic Pollution Coalition that we start promoting the common language for people understanding what the effects of plastic pollution are, and have that become part of the lexicon, the national lexicon. Some images of global impacts of plastic along coastlines around the world. Many of you have seen images like this. There was one of the videos that went viral about 6 years ago was about this plastic straw that was a group of researchers off of Costa Rica were tagging sea turtle migrations, and they pulled out this male turtle and noticed something in its nostril and decided to pull it out. And one of the researchers videoed it. It's 8 excruciating minutes of watching them pull what was an ossified plastic straw out of this nostril. And people got infuriated. And Jackie's work at the Last Plastic Straw got really intense after that. But sea turtles also, when a plastic bag is floating in the water upside down, it looks like a jellyfish, and that's the favorite food of sea turtles. Entanglement is an issue, ingestion is an issue. And as I mentioned with the incineration, air is the global impact in burning plastic has become a huge issue. Alternatives to incineration, and they've been very hard for at least the last 2 decades to stop incineration. And it didn't used to be plastic, but it's become, over the last 5 years, plastic has become the main incineration issue. There's a film that I saw, a clip in it, in which in Southeast Asia, they use plastic to burn for cooking their food. Think about the health impacts of that. Microplastic plastic fibers are showing up in tap water. You can see this from this report from Ord Media. In all of these areas around the world, microfibers are turning up in tap water. Soil, as I mentioned, coming out through sewage and in the sludge, fertilizers. Think about the plastic mulch that's put out on fields, and then that breaks down. It's in the sun. Even protective seed coatings, which was a surprising one for me to hear. Land animals are not immune from picking up plastic. And then the health impacts in the oceans. So, as I mentioned, the chemicals that are used to make plastics, the bisphenols and the phthalates, which are for making them either rigid or soft, and they stay in the plastics. And when these plastics break down and they end up in the waterways, they also become like magnets for other toxic pollutants. And those bioaccumulate and become the food for plankton, and then a larger sea life, and eventually bird life. And then if we're eating fish, there's plastic in the fish too. This is Marcus Erickson. I'm going to play this little video, and it looks at that magnification of toxic accumulation in food products. But Marcus is the chief scientist for 5 Gyres, and they have been doing for about the last 5 years. They've been going out, they do these ocean voyages all around the world, and they do trawler samples looking specifically for plastic pollution, and have done some really significant work with projecting the amounts of plastic that are along the columns down deep from the surface into the deepest parts of the ocean.
So I filleted this fish, thinking I'm going to eat it, and here's what I found. It's full of plastic.
Microplastics hide a dangerous secret. When a piece of plastic litter enters the ocean, the sun and the waves break it down into smaller pieces. These small microplastics float around in the surface layer of the world's seas. Also in this layer are man-made chemicals called persistent organic pollutants, or POPs. These are chemicals such as PCBs and DDT that have been banned for their harmful effect on people and the environment. Like plastics though, they take a long time to break down. Microplastics act as a magnet for POPs and they bind together in the water. The surface layers of the oceans are full of marine life, and many species accidentally ingest microplastics. Once in the stomach of a species, POPs and chemicals associated with plastic manufacture, such as bisphenol A, leach out of the plastic and into the body's tissues. When the smaller organism is eaten by a larger one, the chemicals are passed upwards through the food chain in a process called bioaccumulation. For species at the top of the food chain, like human beings and dolphins, chemical concentrations can be very high indeed, causing severe health problems.
So some of you may have seen some of these. These fancy tea bags. They have plastic in them, beer, salt, and the World Wildlife Federation did a projection that each of us probably eats about a credit card a week of plastic in our normal diets. So what are people doing? Enough of all this bad stuff that I've been sharing with you. There are, as I said, a number of actions are being taken on many different, through many different avenues, from individual through legislation, national and local, statewide, national, and international. There's an organization that was started by Judith Enck called Beyond Plastics. She has an ACT section, which is lots of ways that you can get involved in helping move the dial on this issue. Judith was under the Obama administration, she was the head of the EPA for the New York region, and has a lot of contacts, and she's been very much behind the Break Free from Plastic Pollution Act that was introduced last Congress and was reintroduced just last week. It's being sponsored, it was introduced both in the House and the Senate, and they're looking for individuals all around the country to encourage their local representatives to get on board, either as sponsors or as supporters for that act. There's certainly always local cleanup efforts, but I mean, they can be land efforts or into waterway efforts. There's an annual Break Free from Plastic brand audit that this information goes into to target the companies that are the biggest offenders. And Coca-Cola and Unilever for the last 3 years have been the top offenders internationally. There's personal use. You can make changes in your personal life in terms of reduce, reuse, recycle, and refuse single-use plastics. Carry your own materials like a water bottle and utensils. There's a national reuse network that's promoting alternative business systems, and ones that are in the circular economy are ones like Dispatched Goods and Vessel, and I'm happy to provide links again to any of those, but they're food delivery systems that use recycled material, reusable materials. So if you're ordering food from your favorite restaurant, if they've signed up with Dispatch, then you'll get your food in a reusable container, and then you return that, and then the next step. So you're creating a circular economy. There are innovative materials that are being developed. Mango Materials is using a PHA material. There's mushroom packaging that's happening. A major focus is now extended producer responsibility. If you produce it, you have to be responsible for getting rid of it rather than the public getting rid of it. And that's been part of the problem, is that the onus of of getting rid of materials has become on the consumer rather than on the producer. There's a lot of action on trying to fight the the production of new plants. The Formosa in China was trying to build a new cracker plant in New Orleans, and the local community has been fighting that, and they've had some success in regulating. There's always power of the purse. We as consumers have the ability to buy and to help push safe product development. So if you think about the BPA in baby bottles and other food products, when there was a big public outcry a number of years ago, and now a lot of materials will say BPA free. That of course doesn't mean that it's BPA free, bisphenol free, because one of the things that they've done is some unintentional substitutions that have unintended consequences. And if you substitute bisphenol A for bisphenol S, you're probably having more problematic health issues as a result. Regulation, I mentioned the Break Free from Plastic Act. There's lots of other ones that are happening locally and statewide. Here in California, there are a number, but there are bans on polystyrene straws, a variety of foodware, other foodware caps on cups. The industry has also been fighting with these preemption laws. So some states have bans on bans. So you are prohibited from banning things like plastic bags. That creates some interesting issues when you think about states' rights versus local rights, and can the state prohibit a local area from banning plastic bags? And then ongoing education and building awareness, which is where I had stepped in with a behavioral change project, which I'll tell you about in just a few minutes. I want to be respectful of the time, so I'm going to jump through some of these. But this, when I was talking about the work that the Center for International Environmental Law had produced, looking at the life cycle of plastic and all the health effects that have come from each segment of that life cycle, this is a graphic illustration of that, which I quite liked. So we know that the chemicals in plastics mimic estrogens, and they're linked to cancer, infertility, obesity, diabetes, and other diseases. And these specific bisphenols and phthalates act as endocrine disruptors. The American Academy of Pediatrics, the American College of Obstetrics and Gynecology, and IPEN and the Endocrine Society have all come out with statements with health warnings about the chemicals in plastics and endocrine disrupting chemicals in general and the health effects from them. So at some point a couple of years ago, I was talking to some epidemiology friends of mine and said, can we come up with some very simple way that we can help people understand this issue and see if we can actually make significant change in a fairly simple time frame? So we were able to get funding from the California Breast Cancer Research Fund, and we developed a what I think is a very simple intervention that turned out to be quite effective. And we trained educators to deliver this message about how reducing your use of plastics could help you reduce your exposure to these endocrine disrupting chemicals. And we worked with churches and community groups in the workplace, and we met twice. We met for 45-minute segments. We met a month apart. We did a 20-minute intervention. We showed a few videos. We gave them metal water bottles, and we selected out some women who were postmenopausal to do some blood samples. And these were the primary study messages that we used. You've seen these before. I imagine. And we asked them to tell their friends and family, spread the message. And we looked at a 5-point scale, an initial at that first meeting, and then when we met with them again a month later, and we used a 5-point scale with questions like, how often did you purchase canned goods? How often did you purchase water in plastic water bottles? This was the breakdown of our group. And these were the changes that we saw. And these were actually significant changes. The green ones were the change that we wanted. So we wanted change in the negative direction. We wanted them to use less. And the behavior change was effective. And the message spread was very effective. The screening we used on the blood samples, we did postmenopausal women because we didn't want the monthly fluctuation from the menstrual cycle. And this was an assay that was developed at the City of Hope. And it measured estrogen receptors. So 21 of the women that were in our test did the blood sample. And it was interesting because if you look along the whole line, except numbers 18 and 19, or excuse me, 15 through 19, all the women had significant change just from these very simple changes in their diet. It begged the question, well, what was going on with those other 5 people? And it turned out that they were the normal weight people made the change, overweight, and there was one obese person in the sample that didn't, which looks, we need to look at that further. But the interesting thing, so there were reductions in purchase and eating of canned food and bottled water, and the cash register receipts was another one because BPA is often on those thermal receipts. And they wash their hands more, great behavior change for dealing with COVID, a huge message spread, and an almost 70% drop in the exposure to estrogen in the blood donors. So subsequently, I did projects that were English and Spanish translations with these ongoing groups. That's been part of the work that I've been doing in the last year. I also wanted to mention, and I want to leave time for questions. So these are 2 books that really look at endocrine disrupting chemicals and what's been happening. That the one, Countdown by Shauna Swan, just came out, and she's been doing a tour on a lot of public media, and it's been dramatic because she's really looked at a reduction of almost 50% of sperm count from exposures to these environmental chemicals. And about 20 years ago, Pete Myers was one of the authors of Our Stolen Future that looked at the impact of environmental endocrine disrupting chemicals on wildlife in general. This is again, from CL, the Center for International Environmental Law, and how important it is. And again, once bringing us back again to the connection with climate change and the production of greenhouse gases. The other interesting thing, if we come full circle into where we started and looking at COVID, is that the issues that are problematic with exposure to endocrine disrupting chemicals are also the same conditions that have been documented as comorbidity factors for COVID-19. And when you think about what was being promoted by the plastics industry early on in the COVID crisis, was use plastic, use plastic, use plastic. But the evidence showed that the virus actually lives longer on plastic than it does on cardboard or anything else. So we know that that was, and the industry was really trying to exploit people's fears and promote plastic as a clean alternative. There have been follow-up conferences around health risks and really looking at food packaging. And one of the organizations out of Switzerland, the Food Packaging Forum, has been looking at that. Upstream is an organization that's been working on parallel tracks with Plastic Pollution Coalition to move the dial forward and really help people understand and what the dangers from plastic pollution are, was particularly within food packaging, and creating legislation and to limit that. And so here's some of the things that the Food Packaging Network is promoting. And I was involved with both of these publications, but it's really looking at how can we avoid common toxic chemicals as we're raising our children, which is pretty significant when you're looking down the road in generations. So with that, I'll end this. I think we have some time for questions. I'll stop sharing my screen, and I'm looking in the chat. I don't know if Lisa or Katie, you want to monitor any of that, but please feel free to ask questions. I see one asking if we can.
That was wonderful. There's a question from Cynthia Smith about the preemptive laws in Michigan. So essentially the ban on a ban of plastic bags. And how do we combat that as an issue when communities are really trying to do the right thing, but then the state is preemptively deciding to not be able to do that? That's the first question.
Yeah, it's a huge frustration for those of us that have been working in this area. You know, it comes back to politics and education is a huge factor. Lobbying, getting public organizing within your local communities to go in and lobby your state legislators. That's going to be one of the avenues for doing it. But I don't have all the answers. I have a very dear colleague in Arizona, in Tempe, and they had local legislation around it, and the state came down and knocked it out of them. And she personally is leading a lawsuit against that. So there's the legal avenue to go. I know it's a huge frustration, but when you think about the power and the money involved with these industries, we're little David's going up against Goliath on this.
And that ties into another question that Helen Boyd just mentioned, is that in this pandemic state, we've reverted a lot back to single-use plastics and takeout, and we've done so much work with eliminating those things before this. Now in this pandemic, it's a push again. So how do we combat that as an issue as well? Again,
so these are pointing out the again, we come back to the education issue, knowing this information, being able to promote that, being able to educate other people. That study that came out through NIH, again, I'll be happy to share links to these things, but meeting with legislature, being active in the community. One of the ways that within the city of Berkeley, and I know I get a lot of chuckles about the city of Berkeley because we're supposedly so liberal, and but one of the most effective voices within our community are children. This is their future. When kids become active, there's a teacher in the local Berkeley schools who's been running a zero waste classroom for the last 5 years. So she's now got 5 years of students that have been learning this stuff, and they come to, yeah, you're going to become the voice, Julie Morgan, whoever you are, that they they speak on at city council meetings. And I happen to be at the city of Berkeley a year ago, January, passed a single-use ordinance reduction. And one of the city council members noted that the voices of these children was the most moving to her, in terms of, she was supportive anyways, but if she hadn't been, that would have moved her completely to support a reduction. Some of the ways that are effective for making those changes are really working with the costs of these externalities. So when you think about the fact that the city government has to pay the costs for picking up all the waste that is going into all the trash cans around the city, and that then gets passed on to we as the property owners in the city. When you look at those kinds of things, there are oftentimes ways in which you can create a powerful argument for reduction based on cost. The city is paying for this, taxpayers are paying for that. You need to move that down. So being creative, looking at a variety of ways to do that. And the other thing is, there's an organization I neglected to mention. It's called Rethink Disposables, and it's a subset of the national organization Clean Water Action. And they've been going in to businesses, and they have a lot of case studies now that show that if you switch to reusables from disposables, businesses save money. So when you start looking at where are the drivers within different communities, if you can get business owners, you get school kids, where are those voices that can pressure or that can be a counter voice to the business industries that are coming in to lobby both state and national legislatures. The other thing is, within cities, they tend to be more responsive to the public, to local citizenry, and under less pressure from big business. So, again, it takes creative work and a lot of it, but these are all important questions that you're asking.
Yeah, there's so many great questions in the chat. I hope we can get to many of them. And if we don't, we can always revisit this as a part 2 and have an ongoing discussion about this with the practice forum. Someone wanted to ask about clarification about the issue of obesity and estrogen in the study. If you could clarify that. And just as a tagline to that, I think as nurses, we really see all the plastic waste that goes on in the hospitals. And we have this thought about how are we actually helping the health of our patients when we're harming the environment, and the chemicals that are going into our patients, whether they're infants or anywhere along the life cycle, and then their exposure to the chemicals that are present in the IV bags, for example, that are being infused to them.
Yep, that's actually one of the reasons I got into this work. So I'm happy to work with any of you on trying to move these forward. There's a book called Greening Healthcare that was written by the woman who I'll give you that as a link. She was the sustainability person for Kaiser Permanente National. She looked at a number of these issues. She's part of, I guess many of you probably are involved with healthcare without harm. So there are arguments for doing it from the inside. I was trying to do it from the outside, actually working with Kaiser Permanente here in Oakland, and really trying to see if we could just do low-hanging fruit and get plastic straws out of what they use in the hospitals. I mean, I recognize that there are certain surgical conditions and other things where you need to use flexible straws, but for a lot of just inpatient use, they're using a lot of plastic that they didn't need to, or even just in the cafes where or the doctors are coming to eat. So there's a lot of work to be done, and I would love to work with any of you on any of those projects. There's an organization called a business that started taking blue wrap and making it into bags for when people come into surgery. Rather than getting a plastic bag, you at least get a reusable bag. And again, I can get you the link to that. I was invited, Healthcare Without Harm in Asia it produced a toolkit on what to do in hospitals to reduce plastic, which again, I can give you as a link. I was invited to do a talk to them a year ago, October, when we were still traveling, and talked about the research work that we were doing. So there's movement, there's interest, and we need to keep plugging away at this. A specific area that I'm really concerned or really want to focus on is with pregnant women, because my figuring is that this is fast growth periods of time are important to address these issues, but also you get probably 3 generations, because you get the pregnant mom, you get the baby gets the benefits, and generally there's a grandmother or an aunt or an older sibling or somebody else involved, plus the fathers. So any of these kind of areas are important to continue spreading the messaging. And then the issue of obesity that the one person asked, there was one person in our study, and it was a pilot study. It's something that we really wanted to investigate. And we don't really know what that person's conditions were. It was a blind study. So there aren't, in any good research, you set up some of the next questions. We have requested funding, haven't been funded yet to do more within that area. So that's the best response I can give right now. I hope that, did I cover all the questions that came up on that?
There's a lot of great questions, and I think we might not have time to answer them all, but I think that we should continue this work around the issue of plastics. There's a lot of opportunity, like you mentioned, the blue wrap. Hospital systems can also, move to using reusable containers for sterilization instead of blue wrap. So there's so much to be done on this. And with the last 2 minutes remaining, let's see if we can get to a couple more questions, but I think that we should, continue this. And I also wanted to give Katie an opportunity to chime in if there's anything that Annie's been doing on the policy work as well.
I think at the national level, I think that there's a lot of interest around working, especially on single-use plastics, and as Sandra was talking about, around the feedstock for plastics. So as we're looking at fossil fuel development, here in my area, in the Mid-Atlantic region, they're just building a huge cracker plant right outside of Pittsburgh. And what is just horrific around this cracker plant is that Pittsburgh is making a really amazing effort to reduce their carbon footprint. They're going to be reducing their carbon output by 50% within the next 10 years or so. All of their climate change activities are being negated by that one cracker plant. So, it's the whole plastics life cycle that, we really need to be thinking about. Just as a reminder, as we're wrapping up as well, in order to get continuing education credits, be on the lookout for an email from us with your evaluation for today, because we can't give you the credits without the evaluation. So just be on the lookout for that. And I'll turn it back to Sandra for any closing thoughts.
I thank you for listening. Thank you for your interest. Thank you for your, hopefully your ongoing efforts. And if you want to email me with questions, I'm happy to answer them. And as I said, I'll make a resource list available to Katie and Lisa and Laura, so you can have that. And as I said, I'm working in this area. I'm happy to collaborate with any of you that have interesting projects or need presentations or whatever. So please get in touch. Thank you very much. Thanks for all of your hard work that you do every day.
Thank you so much, Dr. Curtis. We will follow up, and anybody who's continued to be interested in this, we will reach out from the practice forum to continue to work together. Thank you all so much.
Bye-bye. Thank you.